Welcome to Matters of the Mind. I'm Dr. Rick Adams, licensed psychotherapist and professor of psychology and human behavior. This podcast is devoted to helping you understand how the mind is shaped and influenced physically, psychologically, emotionally, socially, and spiritually. For more than 3 decades, I've been blessed with a front row seat into the minds of humanity. And now it's my desire to use that experience to help you, guide you, and assist you through this Matters of the Mind podcast. Today's Matter of the Mind topic is one that cuts across every area of life. So much so that throughout this series, I'll be joined by fellow clinicians, counselors, psychotherapists, psychiatrists, along with both current as well as former registered interns who actively work in the field of behavioral health. Because this is a topic that I choose not to tackle alone. Today's Matter of the Mind topic is mental health. But instead of approaching it from a traditional way, I want to bring it into focus by asking and answering 3 critical questions. Where are we, where we're going, and where we're headed? Because where we are influences where we're going, and where we're going ultimately determines where we're headed. And to help me unpack today's Matter of the Mind topic, I'm joined by a special guest as well as a very dear friend, someone who I believe will be a frequent flyer here on Matters of the Mind, Sandi Burchfield. But before we begin, allow me to tell you a little bit about Sandi. Sandi is a licensed marriage and family therapist, advanced certified Imago relational therapist, and a qualified supervisor for marriage and family therapy as well as mental health counseling. She's also been in the field for 19 years. She's the founder of Family Life Counseling Center, a large regionally based group practice here in Central Florida across 14 office locations. Family Life Counseling Center is now the largest Christian-based private group practice that is still owned by a clinician in Florida. Sandi's also trained in brain spotting. She's also a family court mediator, and together with her husband Donnie, they are celebrating their 10th anniversary of Family Life Counseling Center. They're also celebrating 25 years of marriage with 4 children. Together, they also lead a multicultural interdenominational church called New Wave in Claremont, Florida. Sandi, welcome to Matters of the Mind.
Thank you.
I want to begin by just asking you a few questions, but I want to start by saying I'm just so happy that you're here with us, okay?
And I'm honored that you asked me to come here.
So this is just going to be us talking, okay? But also us focusing on what I believe is very important now, and that's the field of mental health, okay?
Yeah.
So I want to just begin by asking you that question. From your perspective, everything you've seen, not just over the last year, but over the last 19 years or so, up to now, where are we and where we're going and where we're headed, okay? So where do you believe we are when it comes to clinically and mental health?
Yeah, I think we're in a ripe season of people being aware that there is such a thing as mental health.
Okay.
That we're not just all mentally ill or it doesn't exist.
Okay.
So I do think that we've come a long way of understanding that we do need to take mental health seriously.
Okay.
So we have a lot to learn because now it's become aware. Just the awareness is the first step.
Now, when we start talking about that awareness, though, what are the ones that we're seeing an increase in? When you look at your practice and you talk to other individuals that you're supervising as well as your staff, what are some of the things that we're seeing as far as areas of mental health?
So historically, is in our practice anyway, it used to be parents would send in their troubled 12-year-old, and then they would send in their husband, and then they would finally come for themselves. And now I'm starting to see more proactiveness with the middle-aged class, saying, you know what, my kids are having issues, but I think I am too.
Okay.
So they're able to start recognizing that. I think the other thing I'm seeing a big influx is referrals from other medical providers. So not just from psychiatrists, not just from pediatricians, but from GI doctors, from neurologists, from the cardiologist, saying that, this person's got a heart condition. They feel like they do, but we know it's stress. So we're sending them to you. So I'm seeing a more awareness in the medical field too.
And as a result of that, what would you say are some of the underlying causes then of that stress and those other issues that are being presented?
I think everybody's taking on too much. I think going back to everybody wants to do the right thing and they want to do it well. And the old cliche that in America, you can dream and be all you can be. And you can do whatever you've dreamed put in your heart to do. And so everybody's trying to do it all at one time. And so I think it comes down to, I want to do better than my parents. I want to do better than, my neighbor, whatever. So I think it's coming down to comparison and yeah.
And that's one of the things that we always say. Comparison is one of the quickest ways to depression.
Yep.
Okay. And with that being said, though, we're trying to compete with others. Okay. But what is it? What are you seeing individually, internally, though? That when we get past that competition of everyone else, what's really going on internally that you're seeing that people are struggling with?
I think even competing with themselves.
Okay.
Like I'm not doing as good as I should. I should be further along. It's these internal, things expectations that we have for ourselves. I'm not the best mom that I should be. By 30, I should have been doing this, this, and this. So it may not be something that anybody has told them. It's just our internal dialogue.
And where would you say that's coming from? Because in what I see and have seen over the years is your present problem, and I've said this before, is usually not the source of your present pain. Your present pain is usually rooted in your past. And what I've seen is a lot of past trauma. And that unresolved trauma that we don't necessarily fix, so to speak, continues to grow in different ways and impacts us as in society growing up. Are you seeing some of the same things?
I mean, absolutely. I mean, even just the definition of imago therapy is...
And I want you to talk about that too. I want you to, but go ahead, I'm sorry, go ahead.
Yeah.
I want you to talk about
So
that.
it goes back to our unmet childhood needs and our childhood wounds, and they come out in relationships. They come out in other areas. So like you're saying, like it comes out 20 years later. When I'm parenting my own child, or I'm, trying to do a career, and I got my internal dialogue that's coming from my childhood. And whether it was my parents that told me things, it was my grandparents who told me things, or teachers. Maybe it was classmates.
Now you say even 20 years later?
Even 20 or more years later, yes.
Now, because I mean, that's not strange to me because I've seen it before. I've seen it as far back as 40 years. And I remember cases where I work with someone who's in his 60s and he's still struggling with an incident that happened with him when he was 10 years old.
Yes.
And he cannot allow that one incident. He's very prosperous, very successful in life. But he's been on his third marriage. Okay. And that's because when we unpack it, it's that childhood experience at 10 that continues to manifest. So in imago therapy, you kind of focus on that. Can you tell me how you would help someone in that case if that were using that type of therapy?
Yes. So when we all have lost parts. We all have parts that we didn't get from our parents. And so when we're looking for a partner, we're looking for that perfect match. We're looking for someone who completes us. My strengths are your weaknesses are my strengths. We get along great. But what we also realize is because that was my weakness, that's an unmet need, and I'm unconsciously expecting you to fulfill an unmet need that I got from what I didn't get from my parents.
And we both know that that's not always possible.
No, it becomes conflict. That's where all the troubles and struggles come.
And I want to flow with you there, okay? Because I see conflict a lot. We both see conflict a lot. And we're not immune to it ourselves.
Right.
However, from a mental health perspective, that conflict grows into what? Is it just the chaos that it grows into? What else can it grow into?
It grows into a lot. It grows into projection. I'm going to blame everybody else, or I'm expecting everybody else to do something that really I either should be doing myself, or because I didn't get it from my parents, I need to get it from the Holy Spirit. I need to get it from God or some other external factor. Or if I can't give it to myself, I can't put those unrealistic expectations on my kids, my spouse, my coworker.
But we do, though.
We do all the time.
But we do all the time.
All the time.
And let's stay somewhat relational. What are you seeing as far as where we are with regards to couples and married couples? What are some of the stressors, the strains, and that is unfortunately pulling them apart?
Number one, they all come in for is communication. They
Okay.
say we're not communicating, we're not on the right page. And it's really not the communication, it's really understanding what they're communicating about, because they don't even know what they're communicating about. A simple example is he never listens to me. He never takes out the trash. He never, takes care of the dishes. He sees I'm doing all this for the kids, and he's watching TV, and it's
Or
not
playing video games.
or playing video games, and he doesn't realize that he's playing video games to avoid being put down, being belittled, being critical, because he probably came from a hypercritical mom who he could never do chores right, so why bother? And so then he doesn't even try. And
So what you're presenting then is there's
two unmet needs.
a lot of internal conflict.
Yeah.
And that internal conflict, if not dealt with, will definitely be projected out, correct?
Yes.
Okay. And how does that ultimately impact the kids, though?
They see mom and dad arguing all the time. They don't always know exactly where it's coming from. They just know, okay, mom's yelling at dad, dad's yelling at mom, dad's avoiding mom. Okay, then I'm going to have my own internal dialogue now. When I get older, I'm going to do this, this, and this. Or maybe I'm going to be the people pleaser, and I'm going to help mom with the chores just to keep the peace. And so now I'm not able to fulfill who my own identity is. I'm only doing it to make mom happy.
Which brings me to what I'll call negative stages of change. And yeah, you're changing and you're growing and you're maturing, but you're doing it
For
totally,
someone else.
Exactly. Which then impacts their family, which impacts their kids, and then you have that generational thing that begins to follow.
Yes.
Now, that's good, because it leads me to the next stage. If we're talking about where we are, from your perspective, where we're going, if we don't address these matters from your perspective clinically, where you see us going as a society when it comes to mental health?
So if we don't take care of this, what I am seeing already starting to happen is social media. People go to get their needs met through social media. So I'm going to go on TikTok and I'm going to find everything that tells me all about how I'm doing things well. Or finding people, the whole trauma bonding, I'm going to find people who are dealing with and struggling with the same thing as I am. So instead of doing it as a support, it's more feeding into more of the internal dialogue that I have that may not be healthy.
Let's land the plane there. Because last week I had Dr. Bacham here, Dr. Shonda, who we both know, and she was presenting how people are actually going to chat to get their diagnosis, to get their counseling.
Yep.
Okay. So can you speak to that when it comes to, if we continue to use social media as our therapist and use social media as our identity, what impact can that have on us as well as our family from your perspective?
I think it puts us more in isolation. It puts us more into nobody understands but me and this computer or this phone. So even with ChatGPT, with the AI things that are coming out now, it only gives you what you feed it to. So
that's good. That's good. And I have to say that all the time, that what you feed it is what you're going to give it. What you put in is, and if you put in what you want people to see you as, that's what you're going to get.
Yes. And because my way of thinking is distorted, then they're only going to see, or ChatGPT is only going to get a distorted view of me and a distorted view of my spouse or my friend or whoever I'm struggling with. So it doesn't have the emotions behind it. It doesn't have the internal infrastructure to understand that there's different dynamics going on within just my conversation with this thing.
Let's then, and you brought up an excellent point. So let's talk about distorted thought processes. You and I know what that is, and you and I, from a clinical perspective, have studied and worked with individuals who have distorted thinking. Let's kind of break that down, though. When you say distorted thoughts or thinking patterns, what are you presenting that to be?
So my perception is my truth. Your perception is your truth. So when I'm thinking something, I start having this conversation with myself and as though it's true. So for example, she's lying to me. She's lying to me about XYZ, and I didn't even hear it right to begin with. I see this a lot. I'm going to put it with my student interns. So a student intern will come in and say, I'm confused. I think everything is dysfunctional right now because she's telling me one thing and you're telling me another, and somebody's lying. And it's like, no, I'm not lying. You fed me a question, or you gave me a scenario and I answered it, but you gave them a different side of that scenario. So their way is true and my way is true, or my way is accurate.
Which is why when I do marriage counseling, I'll try to start with this question and say, we're not here to deal with the truth, okay? But we are here to deal with your perception.
Correct.
So I'll say, you give your perception, and you give your perception. And the issue is when you give perceptions, you cannot say somebody's wrong or right, because
Right.
that's their view, that's their lens. And I'd say, let's stay away from the truth. We'll get to the truth. The truth will eventually come out. But for now, let's deal with perceptions.
Yeah.
Because as you said, your truth, my truth begin, and we know from a faith-based perspective, there's only one truth.
The ultimate, yeah.
Exactly.
But he's the only
However,
one who's all-knowing and all-seeing to see all lenses.
there you go. There you go. And the other thing too is you presented something that the three, I do what's called Trinitarian therapy, and I present to them that the three things that will always impact a marriage is miscommunication, misunderstanding, and misinterpretation. And I'll ask them, which one are we dealing with?
Right.
Now, usually I say all three, and I'll say, okay, no. Let's just pick one. Which one is really impacting your marriage? Is it the miscommunication? Is it the misunderstanding? Or is it misinterpretation? What did you just hear that they said? And that's something that, as you said, that miscommunication is a big thing. Now, with that being said, from your perspective, where are we going with regards to young people? Because we both in our careers have serviced a lot of young people. I used to work at a runaway shelter for teens, and having worked in that environment, and now I'm not seeing it getting better. I'm actually seeing it getting worse. Okay, from my perspective.
Yeah.
So what are you seeing from your perspective?
I think it's two-sided to that. So maybe clarify your question, and then I can answer.
So as far as where we're going, how is it impacting teens, and what do you see that's not just the negative or well, from this perspective, the negative or positively, what are you seeing as far as the direction that our youth is going?
Okay. So on one hand, going back to social media, there's a lot of awareness. So I'm seeing more and more teens more aware of maybe my mom's not trying to be so critical, but I can see where she's had this, and this from my grandma. Like, I'm seeing more teenagers actually being more aware of maybe it's not my mom's crazy or my mom's always angry, but there's a reason behind it. But then what does that do to me? Now I'm too understanding, and I just let my own feelings and my own things go to appease my mom. And then I'm still left in the dark with my own personal stuff that what she said hurt me, or what she said was confusing. And now I'm trying to parent my parents at the same time.
And then when they get in a relationship, how does that impact them? Because they're not dealing with their own stuff. Correct?
Right. So going back to my unmet needs. So now it's like, you never listened to me. You never, and the poor husband sitting there like, you didn't even ask me a question. So, but they're assuming because that person has grown up now, and they've started to appease their husband, and they're trying to make his life, because again, they're trying to be a microtherapist and understand and be aware of their own mental health, but their husband's mental health, but he doesn't know that what he's saying or doing is hurting her. And so she stuffs it, she holds it in, and then it all comes out, and he's like, well, you never even asked me, or you never even told me that.
Now, we both do faith-based Christian therapy, okay? What are you seeing as far as how that is strengthening your practice, as far as being able to work with individuals from a faith-based Christian perspective? But also, how are you able to work with individuals who may not necessarily have that same faith-based Christian perspective? Because we both still serve individuals that may have a different faith, but we don't steer away from our own faith, okay?
Right.
So how are you seeing, from a mental health perspective, how are you seeing, coming from a faith-based perspective, strengthen the aspects of mental health, and what are some of the challenges?
Yeah. So the strength of that is there's this existential part of thinking. Like a lot of us go into, we've had traumas happen or we've had trials or situations that were beyond our control. So a lot of people are coming in like, why me? Why is this happening? Why would God do this to me? So whether they're religious or not, they're still asking the question, why me? Why is this happening to me? Or what's going on? And they don't understand. So coming from a Christian perspective allows the freedom and the openness to ask those questions and dive into them. Not necessarily religiously, but being able to go outside of myself, that there's other things that are going on that could be causing or could be part of the reason why things are happening. With other, and so going back to people who are maybe non-religious, we're able to still give them that platform to ask those questions outside of ourselves, that something's beyond me, something's beyond the people that were in the room. Was there a demonic thing? Was there a spiritual thing? Was it just chance? Is it something out in nature that has caused this? So it gives the opportunity for that to be more open. It also allows for spiritual abuse and spiritual trauma to be more open to talk about, because we do get a lot of clients who are Christian. They believe in God, but they're been betrayed or hurt by a superior, whether it was a youth pastor or a worship minister or the lead pastor. And so there's a lot of church hurt stuff that comes in, which also goes back to their own unmet needs growing up, their childhood wounds, and they've projected it and put it onto their leaders or allowed their leaders to take a parental role that they should have never had.
And I want to land the plane there for a moment, because in my 30 plus years and in your 19, so together that's 50 years of experience we had, I want to talk about somewhat of an uncomfortable subject, and that is those who've been church hurt. And I want to talk about that because from a mental health perspective, I see, as well as yourself, individuals who were in the church, and we're seeing young people now who were in the church and then go to college and quote, fall away. Of large percentages, okay? And from a mental health perspective, we know that them falling away is actually going to increase the probability of having mental health issues, especially self-harm and anxiety. So, twofold. How can we help them, okay, when so that they don't lose that when they are leaving to go out to college and also deal with these things called life. But also, how are we able to help those who actually have been church hurt before they leave? Because I've seen a lot of that, and I see those who are really church hurt, not just because of abuse that they may have experienced in the church, but I've also seen them, the church hurt, when they've really said, I prayed and I asked God to help me and to save my mom or save my child, and he didn't do it. And that's the other church hurt that I've seen. But more church hurt that I've seen, though, is when, like you said, those leaders who are a reflection of God betray that trust. Okay? So let's speak to them.
Yeah. So going into trauma, you have to build that rapport, build that connection, help the client feel safe, even to be able to discuss things. So first getting into helping them understand that what they did or what they heard or what they experienced was wrong, that they should. So being able to validate and support and empathize with them and work through their pain. Because if they're still in their pain, they can't get past the fact that this person was a leader, which means I can trust the next leader, because I can't trust any leader if I can't trust this one. They put them all in the same basket. So we got to first get through the trauma of what actually occurred and what actually happened to them. And once they can understand where that pain comes from and be healed, now they can see that other person as another broken person, which means I can go to the next church or the next leadership, and I don't have to, again, put my unmet wounds from this person projecting onto the next person, the next leader.
Excellent. Which brings me to something, because oftentimes I'll present to them that we pain and hurt are in the same boat, but they're on two different sides.
Two different levels. Mm-hmm.
Okay. And as you said, we got to address the pain and we got to heal from the pain, but the hurt can stay forever, you know? And when we lose
being able
someone,
to recognize that too, like whenever I get triggered, so I go to the next church, or I go to the next, I join a different ministry, and I start to hear or see some of the similarities for what I heard, and it's like, oh, my radar goes up because I'm hurt.
I'm triggered.
I'm triggered, yeah. So being able to recognize, wait, I'm triggered. I need to deal with that. Where is that trigger coming from? Why am I feeling that way? And did this person really mean to do that? Are they really the person that was from 5 years ago? So being able to deal with what is that, and do I need to address
work,
it?
Though.
It does
takes work.
Takes work, a lot of work.
And I think sometimes people forget that therapy is work. You know?
And it's a lifelong journey, even if it's not with the same therapist the whole time. Like, I think we think that when we got healed at 18, we're still dealing with an 18-year-old brain. So at 30 years old, we may need to come back and readdress some things that I understood and agreed or was found healing at 18. But now that I'm 30 and I've been through some things, I've had some experiences.
Different perspective.
Yeah, and now I'm a little bit more mature. So now I can understand that same scenario, but 10 years later. So I need to go talk to somebody else. And so yeah, therapy and mental health is a lifelong journey.
Which is why I sometimes distinguish between counseling and therapy. Okay, and I say that counseling is guidance and direction. Therapy is surgery.
Yes.
And that surgery can hurt a lot, and so can counseling if it's given by the wrong person. Okay. Now, lastly, we've talked about where we are. We've talked about where we're going, where we're headed. Okay. Where we're headed overall, if things improve where we're headed, but also if things do not improve. Because from my perspective, I do see a remnant of young people who are striving and doing wonderful things. And I see the remnant of couples who overcome so many tragedies and are prospering in different ways. Okay. However, overall, I'm not seeing that as a whole. Okay. So from that perspective, where are we headed?
Yeah. So I will talk on the negative side first, because that's scary to me, of what if we don't get this right and we continue to make things worse by not becoming aware, not dealing with our own struggles and traumas, is we'll just keep repeating the cycle of abandoning ourselves, projecting onto others, isolating by getting deeper into social media and things instead of actual people. And it kind of brings me into the thoughts of maybe there's end times coming soon of, we're causing our own humanity to, demolish by going to computers and machines to think for us. So that's the downside, I think, is that we'll just continue to perpetuate the same cycle that history has already shown us. But now we have other things involved, like machines and AI and things that are beyond our control.
Makes Terminator seem real.
Yes. So that's the scary downside. I think the positive is that if we can change history, and we don't have to keep repeating things. And we, society and globally as a world, we have come so far in our knowledge and our technology, and we can continue to do those great things to maintain our country, to maintain our earth, if we can understand just our own basic mind. and I say basic, but it's not basic, but being able to understand who I am as a person, what my purpose and fulfilling is, why did those things happen to me, to be able to cause, for the greater good, but also that you have the same thing going on for you too. So, yeah.
This has been so good. Okay.
Yes.
So I have got to have you back.
Yes, I would love to come back.
There's so much more that I want to unpack, and I just want to leave with that abandonment, which leads to anger, which leads to abuse.
Yes.
And I want to talk about just those 3 A's of and how do we approach that as well. So I am looking forward to our next meeting on Matters of the Mind. Okay.
Yes.
So thank you so much, and thank you again.
Thank you for having me. It was a
You're
pleasure.
coming back, right?
I will come back.
All right. Thank you.
Thank you.
You've been listening to Matters of the Mind, a podcast that focuses on matters that affect the mind. I'm Dr. Rick Adams, licensed psychotherapist and professor of psychology and human behavior. Come, join me on the couch as we discuss matters dealt with, matters dealing with, and the matters that we avoid.